Hello and welcome everyone. I'm Shani Lazarus, your go-to host for today's exciting webinar, Best Practices for Healthcare Contract Management Excellence in 2024. We are delighted to have Sunil Masan joining us as a key speaker today. Sunil is a thought leader with over 2 decades of enterprise software product experience in healthcare and life sciences. Sunil delights healthcare customers with innovative sourcing, contract and revenue management solutions he expertly architects and brings to market. Sunil currently heads product at Avenue, a source-to-pay solution provider on the ServiceNow platform that transforms sourcing and contract management processes with AI and purpose-built solution across industries. And we also have Mihir Shah joining us today. Mihir is a seasoned product manager in the source-to-pay domain. Mihir has solved customers' pain points across industry verticals, including healthcare and BFSI, using innovative AI-driven technologies. At Avenue, he leads innovation in source-to-pay solutions on the ServiceNow platform. We are looking forward to Mihir delighting us with a demonstration of Avenue's industry-differentiated solution for healthcare. Just quickly, I would like to share that this webinar will be recorded. We encourage you to stay engaged, react, use the chat, and post questions so we all get to learn. And yes, we will have ample time at the end to answer all your questions. Let's get started then. Healthcare continues to evolve rapidly, partly due to technology advancements and in part due to inherent and market-driven challenges. Before we jump into the heart of the matter, Sunil, talk to us about what you're hearing in terms of challenges that healthcare is facing and what to expect in 2024.
Thank you for that kind introduction, Shiny. We clearly have a diverse audience from across healthcare and life sciences joining us today. And I'm pleased to see a pretty large turnout from IT and non-legal folks as well. Honestly speaking, there isn't a whole lot out there on how core business process tools like contract management software can help address healthcare industry challenges. And hence, I'd like to thank you, our audience, for giving us the opportunity to share best practices and insights that will help you in your healthcare contract management journey. Let's talk about some of the challenges that we are facing. I'm sure all the statistics that you see on this slide, they're not new to you. Healthcare has been seeing turbulence for a number of years, and this has only increased since the pandemic. In 2022, 50% of US hospitals reported negative margins. There's a clear rise in the overall costs in healthcare, and there's a rise expected in 2024 due to labor shortages, rising drug prices, and new provider contracts as well. You can see some more detailed statistics around the shortfall that we are facing in terms of the required primary care physicians, dental practitioners, and mental health practitioners in all of the areas that reported a shortfall. And these challenges now, while a number of these statistics were gathered from providers, from hospitals, clearly challenges faced by any one segment within the healthcare and life sciences value chain would not be limited to just that segment. Those challenges, they permeate because all of those cost pressures get surfaced back to drug manufacturers, device manufacturers, payers, and then, of course, the consumer, the end patient itself. Now, when we think about best practices for contract management, there are clearly those traditional best practices we all know about already. Standardization of contract types, standardization of a clause library, standardization of workflows, bringing together harmony across all of the users, across all the stakeholders. And hey, don't just take on everything at one time, crawl, walk, and run. We know all of this. When I think about best practices, we want to go beyond all of this, especially for this industry itself, right? Now, in my mind, best practices, they should address industry complexities. Clearly, we have process related complexities. There are GPO and hospital affiliation checks that need to be performed when a contract is being put into place. For provider contracting, there are specific onboarding and credentialing processes that have to be in place before the contract can be established. There's validation against sanctions databases that needs to be handled, and so on. Similarly, there's data management complexity. Our contracts across the board, they contain fee schedules, they contain tiered pricing, they contain a whole participation list, they contain procedure codes. There's regulatory complexity as well that needs to be handled and incorporated into the best practices. And finally, contracts are the heart and soul of businesses. The contract, once established, it needs to flow through into all dependent systems. And again, there are upstream systems and solutions that need to connect with the contract management solution as well. And hence, what we've done, we've come up with our own set of best practices that we'd like to share with you. And the first best practice I wanted to share with you is to digitize your contracts. Now, clearly, all organizations across industries, actually, they deal with third-party paper contracts. They deal with legacy contracts. And in today's world, AI can help. AI can help you extract key terms, clauses, and obligations from agreements. And now when I'm referring to terms and clauses, I'm not just referring to the standard start and end dates or the term of the contract, but once again, healthcare specific terms like claim submission period, clauses as they relate to this specific industry. I mean, beyond extracting termination and liability clauses, there are industry specific clauses as well as they relate to claims, as they relate to adherence to HIPAA and other anti-corruption, anti-bribery laws. And once you have those extracted, that gives you your centralized contract repository, which you can then, because it's digitized, you can then go ahead and connect that data to all of the dependent systems. Your fee structures can now be shared with claims management systems so that those claims can be verified. You are now able to search, browse, and report on that data more intelligently. You're able to track contract events, and then you're able to manage performance, whether it's a provider performance or supplier performance or your own performance through obligation extraction. So that was our best practice number one, digitize your contracts, but more importantly, ensure that your extraction models are trained for healthcare use cases, or they are flexible enough to be trained for healthcare use cases rapidly. Now let's continue on that theme of flexibility and move on to best practice number two, which is focus on flexibility and agility. Now here, instead of focusing on features, encouraging everyone here to focus on what you can achieve with the flexibility and agility. Clearly, we saw in the pandemic, there were new business and engagement models, telehealth, virtual care. There was a significant uptick in those types of engagement models. We are still seeing shortage of providers. So ask yourself the question, can you quickly set up a new fee structure contract type without system downtime? Can you rapidly generate agreements and amendment letters in bulk to react to something that is happening, to react to the turbulence that is happening in this industry? Can you quickly modify a predefined approval workflow, all without system downtime? And can you effectively collaborate with providers and other vendors virtually? So that was best practice number two, focus on flexibility and agility. Best practice number three, ensure contract information access, once again, for real world use cases. You've probably heard all of these different search types that I've called out on the left. There's document search, searching for terms and phrases within a document, as well as all of the addendums and attachments that accompany the contract, searching using keywords, proximity search, natural language and semantic search, and then browsing or making use of powerful contract and account hierarchy relationships. You've probably heard of all of these, but once again, what I would encourage you to focus on are those real world use cases that you're looking to solve. Of course, clearly, you want to keep your track of upcoming renewals and terminations and contracts and requests that have been assigned to you. But then what about those advanced use cases that can help you manage or help you react to the turbulence that we just talked about? Contracts containing force majeure or claim submission period. How quickly can you find those? Contracts containing submission period and pandemic within 100 words. That's actually proximity search. Now, let's dig into this example a little more. Contracts containing submission period and pandemic within 100 words. Probably during the pandemic, your contracts were relaxed so that, extended submission periods were approved. You may want to just make that language a little more stricter and not provide a very wide window for claim submission period. You want to be able to access your contracts and the information embedded within contracts using some rich relationships. For example, you may want to search for all facility contracts of hospital coming up for expiration and those that have post-termination obligations embedded within that contract. So that was best practice number 3. Ensure contract information access. Once again, the important aspect here is for your real world use cases. That takes me to best practice number 4. Once again, it's AI focused. Focus on AI driven insights. Now, the first 3 examples that I've listed over here, clause deviation, risk, and missing clauses, those are insights which AI can help you generate. And those are insights which will help you put a contract together and negotiate better. Now, the other 3, contract summaries and clause simplification, these insights would help other departments because, once again, procurement, sales, clinical services, non-legal folks, they would highly benefit from simplified, understanding complex legal language, from clause simplification, as well as just an overall summary of the contract. We've heard from many of our customers that contract summaries have been extremely helpful, even when they send out contracts for approval or, before final signature, they go and share the contract summary back with stakeholders to get their final approval. And then, the last type of insight I've called out is intent-based inquiry. What is that? In simple terms, here you don't know exactly what you are searching for, but what you want is you want AI to understand your intent. So let's look at some examples here of intent-based inquiry. You may just want to ask the question, can I terminate this contract today, instead of going and searching for the specific clause that has a termination notice period and any associated obligations and considerations that need to be kept in mind prior to termination. You may want to validate whether this contract is HIPAA compliant or GDPR compliant. You may want to ask the contract a question, what remediation steps I need to take for breach of PII? How many days does the provider have to submit claims after termination? And then, can the device manufacturer change my contracted price without any notice? So over here, AI can help understand contracts just like humans do. And yes, over time, AI will do it much faster than humans and be able to provide an answer to you versus you knowing exactly what you are looking for and then trying to go and scroll through or search through hundreds of pages of that agreement. Okay, finally, we move on to my last best practice, which is be platform centric. Now, everything we talked about in terms of flexibility, in terms of reacting to market conditions, you'll be able to do that even more powerfully if you have a robust platform in place. And all the top considerations that I've listed out here, I'm sure you are already familiar with. Now, when it comes to being platform centric, it's important to look at this from a future perspective. Platform-based business models have changed the way we live, work, and receive care. A health experience study conducted by Accenture reported that there is a growing number of healthcare leaders that are seeking to consolidate independent software applications into an integrated enterprise platform. And that's what I want to encourage you to keep in mind for the future. And this is what it translates into. You want a platform that will help you scale as you grow. It'll help you scale as you're looking to enable additional processes. Does the platform have the additional complementary superior grade applications that you can enable in the future? Does that platform provide you with UX consistency and richness across all of those applications? And how easily and seamlessly can those solutions connect with each other without the need for any expensive technical integrations, i.e., does the platform support a true single data model experience, connected experience or not? That is something to keep in mind to scale for the future. And yes, finally, I wanted to leave you with this thought that any best practice you incorporate, you should look at, and you will most likely be able to look at scaling that across all your healthcare and life sciences contracting arrangements. For example, if you implement best practices as they relate to fair market value validation on a provider contract, you'll likely be able to scale that across. Similarly, management of affiliations, management of networks, those would apply to pretty much all types of agreements that we see here that I've called out over here. So any best practice you implement, you'll be able to scale that and make sure, theoretically, I'm saying you will be able to scale it, but practically that's something I'll encourage you to evaluate in your consideration as well.
Thank you, Sunil. That was truly insightful. The best practices one should incorporate to elevate healthcare contract management make sense. But I would love for our audience to visualize what they look like once incorporated into a contract management solution. To do so, let's turn the spotlight over to Mihir, and I'm going to request him now to delight us with a live demonstration of the same. Mihir, all yours.
Thank you, Shiny. Let's jump straight into it. Unlike a traditional contract management demonstration that takes a contract request to initiation, then authoring and negotiation, right till activation, today I'll focus on key best practice themes of enabling a connected contract management experience and empowerment through flexibility, digitization, and accessibility. While many of the capabilities I cover today are centered around provider contracting arrangements, I'm sure you'll appreciate how these best practice and capabilities can be applied to various healthcare and life science contract arrangements. I will quickly log into Avenir Provider Flow, a pre-configured solution on the ServiceNow platform that enables provider onboarding, contract management, and performance management. We will start with Avenir's incredible capability in digitizing third-party and legacy contracts. Our advanced AI model comprehends complex legal language enabling extraction of terms like provider name, NPI ID, provider address, and contract type. The extracted terms are seamlessly mapped to relevant contract metadata fields accompanied by an AI-generated confidence score for each term. Material clauses like termination, beneficiary billing, insurance, and liability are extracted and tagged to relevant clause categories. Clicking on any clause highlights the corresponding section within the contract document for quick reference and review. Our AI extraction model also extracts obligations from third-party paper, and these are available under the Obligation tab. The obligations are automatically categorized and tagged to categories like provider compliance, payment claims, and provider performance. Important obligations can be marked for tracking and be assigned to a task owner for completion post-contract activation. Utilizing AI for extraction and bulk upload of legacy contracts is critical to contract digitization. It enhances accuracy, enables faster identification of information, faster access to contract, which you will see in a bit, and easier integrations with dependent systems. Avani's proprietary AI also extracts tabular information like SLAs, fee schedule, and scope of work from any contract. The extracted fee schedule table is available within the application and contains crucial information like CPT code and the service rates. These rates can now be cross-referenced and benchmarked against fair market value sourced from third-party providers. In cases where the rate does not align with the fair market value, the contract manager can provide exceptions for departure from the FMV rate. These exceptions, along with the fair market value deviation, can be accessed in the provider dashboard for review and audit purpose, ensuring stringent compliance. Earlier, we talked about the ability to search for contracts after digitization. Contract managers can search across the entire repository using targeted keywords and natural language queries. Stakeholders across the healthcare organization can pinpoint contracts with specific clause related to compliances like HIPAA or CMS regulations, payment terms, reimbursement structures, and billing procedures. Next, I would like to introduce the capability to establish a parent-child relationship between contracts and easily traverse the contract hierarchy. Consider a scenario where there is a parent GPO which has a purchase agreement for medical equipments and is linked to individual purchase agreements for each healthcare facility. This enables centralized oversight for GPO contracts while allowing specific facility-level modification, renewals, and amendments. This structured framework ensures a cohesive management strategy, offering flexibility for different operational levels, thereby enhancing efficiency and customization, all within a unified contract ecosystem. Now, let's explore another set of capabilities that a contract management automation must incorporate: AI-driven insights. This covers human-like ability to understand and summarize contracts and risk and deviation identification. This also covers the unique ability to ask intent-based questions of a contract and surface crucial information. Here, Avani's AI-driven question answering capability revolutionizes the way healthcare professionals can interact with a complex contract. Healthcare professionals can now ask nuanced questions. For example, what is the specific insurance coverage mandated for providers as per contractual terms? Another great example of intent based insights would be, is this contract GDPR or HIPAA compliant? There are many such use cases which can be enabled on contracts and contract repositories to lower cost, maximize revenue, and minimize risk. In our next example for insights, our advanced AI compares clauses from the third-party paper with pre-configured library clauses and golden contracts from the repository. It then generates a deviation summary and a score. Tracking for high deviation clauses facilitates focused effort to reduce deviations and streamline contract terms effectively during negotiations. This not only expedites contract reviews but also minimizes risk by ensuring closer alignment with standardized clauses. Leveraging the power of AI, our platform swiftly generates comprehensive contract summaries, condensing complex legal jargon into easily digestible insights. This feature ensures quick access and download of vital contract information across contract lifecycle for all stakeholders, facilitating informed decision making during the approval and review process. Next, I have a number of examples to illustrate the power of a connected experience that seamlessly integrates processes to boost productivity and mitigate risk associated with fragmented data and data silos. Using Avani Provider Flow, onboarding specialists can connect with provider via portal. Onboarding for provider starts from a self-serve form where any of the individual provider, network, care staff, or contractors can initiate an onboarding request. Now, the provider manager verifies the NPI ID and after the verification sends across a pre-configured onboarding template to collect detailed provider information like provider address, network details, licenses, tax, and insurance information. The provider in turn submits the requested information through collaboration portals. Subsequently, the provider manager undertakes a review and assesses the compliance by cross-referencing against various federal and state exclusion lists, including OFAC SDN, CMS Preclusion List, FDA Debarment List, and others, all automated with a single click. Upon successful verification of information, the provider can be approved for selective processes such as contracting, invoicing, and payments, and subsequently the provider can be marked as onboarded. Now I can initiate a contract request from the onboarding workflow itself and seamlessly redirect the provider manager to create contracts based on various pre-configured templates like provider services agreement, BAA, network agreement, and more. From within the provider information section, the provider manager can also view the provider's contracts and obligations. You can clearly see how the connected experience accelerates cycle times and eliminates silos. Similarly, depending on your process, you may want the contract manager to initiate the onboarding or additional information request. Avani's connected experience allows you to do that from within the contracting process itself. This eliminates back and forth with the provider onboarding group. Once the contract is active, the contract manager can evaluate performance by leveraging Avani's AI-driven obligation extraction. Obligations tied to this contract are available under the Obligation tab. These obligations are intelligently categorized and automatically tagged to categories like provider compliance, payment claims, and provider performance. A comprehensive dashboard displays obligation fulfillment details, including the status, start date, and the end date. Finally, when contracting with an onboarded provider, compliance process becomes seamlessly efficient as pertinent information and compliances are automatically fetched from the provider profile. Vital details like the NPI ID, provider address, and the credentialing information can be verified with a single click. The contract manager can also refer to the related list, which captures vital information gathered during the onboarding process, comprising of the compliance checklist, which contains the compliance results along with the statuses, the network details, and the documents, which contain various document types like the provider license, the hospital coverage letter, and the CAQH application along with the status, among others. Now I will showcase how Avani's mass contract functionality helps in streamlining contract management, ensuring HIPAA compliance through BAA agreements, enabling network or payer expansion, and maintaining updated contracts in line with evolving regulatory standards. This functionality significantly reduces contract cycle times and optimizes contract management processes. The mass contract feature offers contracting manager two primary options: creating a new contract or amending existing ones. Creating a new contract with the mass contract feature is a breeze. Contract managers efficiently select a template and promptly send it to selected providers. This enables simultaneous creation of multiple contracts. For example, a single mass contract event can generate multiple contracts, with each provider receiving a separate BAA contract for signature, guaranteeing compliance in handling patient data. Similarly, mass amendments mirror the new contract creation process, but involve sending an amendments template across multiple providers, ensuring a cohesive updates and modifications throughout.
Thank you, Mihir, for the detailed demonstration. Before we jump on to the questions and answers, I would like to quickly tell everyone what Avenir offers. We offer an AI-enabled source-to-pay solutions on ServiceNow platform. These include contract and obligation management, vendor onboarding, and AP processing solutions that have been implemented by a number of customers in healthcare and life science industries. We have time left for questions, so let's get right to it. There seem to be quite a few questions today. Sunil, you talked about training of AI specific to healthcare use cases. How long would it take for Avenue's AI models to get trained?
So Shiny, and to the rest of the audience as well. Now, for a number of healthcare specific use cases, our models are already trained. But, of course, as I shared a pretty vast number of use cases and healthcare arrangements. So depending on the use case, I would say an additional 2 weeks of either configuration, not necessarily training, or training itself. So it's about, another 2 to 3 weeks to enable um, a few more sets of use cases of healthcare contracting arrangements.
Okay. The next question here I see is getting a payer and supplies agreements extracted using AI will be huge by itself. Can we just implement that piece?
Okay, so if I understand the question, it was about payer and supplies agreements. So the answer is yes. Avenir offers a repository-only solution, an AI-powered repository-only solution that helps with the AI-enabled extraction of all of the terms, clauses, and obligations that we talked about. And then, of course, that repository then has additional capabilities as well in terms of access to the information. We talked about contract hierarchy, searching using AI, and other types of search. So those are all available with the repository version.
Next question is, are device and drug sell side and distribution contracts supported?
Absolutely. So the number, I know we covered a number of examples as they relate to provider contracting, and other types of hospital contracts. So when a hospital actually contracts with device manufacturers or with other life sciences manufacturers and distributors, that's a buy-side arrangement, of course. But then, the reverse of it, essentially the contract is the same. So all of the core capabilities that you saw, the ability to manage different types of pricing structures, the ability to manage participation and affiliations on a contract from a provider lens, the same would apply even if it were a sell-side contract that drug and device manufacturers are looking to enable.
The next question I have here is, we already have a contract management solution. Can we only use the performance management piece you showed?
Oh, absolutely. So Avenir offers its obligation solution standalone as well. So our obligation management solution connects with, of course, Avenir's own contract management solution, but and in addition to that, it also connects with any other contract management solution that you may have already implemented.
I saw you have an invoice processing solution. Does your contracting product connect to that and other payment systems? We need that for regulatory reporting.
So yes, okay, I can see why you would need that for regulatory reporting. I mean, especially, in a highly regulated industry, when you have, to report against report for Sunshine Act compliance or report against, adherence to fair market value norms, you absolutely need to take the fair market value that's on the contract, any exceptions to that, to the fair market value rates, and then also match that up with what is actually being paid out to providers for any service, right? So yes, getting back to the original question, absolutely. Avenir provides that invoice processing solution, and there is really no technical connectivity required because both our solutions are on the ServiceNow platform. So for regulatory reporting, if you had to match up the actual invoice information with the contracted rates, that's absolutely possible. In addition to that, we would be able to also do, we would also be able to integrate to external payment systems and ERPs for the same reason. Yeah.
Okay, thanks, Sunil. Just 3 more questions. Compliance checks for provider information. Can we directly plug those into contract management?
Yes, absolutely. In fact, that's the flexibility aspect that I kept talking about during my presentation. I would actually encourage everyone to look for these types of flexibility enablers where you can take a sub process or a particular feature and have that be implemented in different parts of the entire process. So absolutely, compliance validation for all the information that is collected during onboarding. Um, those types of checks can absolutely be plugged in during the contracting process as well. And in fact, you want that even during the life of the contract. You want to keep monitoring, for example, any violations that may have occurred. I mean, if the provider appeared in a sanctions database, you want to be notified about that. So the answer is yes, absolutely.
Next question is interesting. We don't have ServiceNow. Can we still use your solution?
Yes, absolutely. You can still use our solution. You don't need to have ServiceNow implemented to use Avenir.
Okay. Next question is, we have ServiceNow VRM. How will your solution connect to VRM?
Okay, that's vendor risk management. ServiceNow's vendor risk management. So the beautiful part here is, once again, no technical integrations are required to connect to any other Avenir application on the ServiceNow platform or any of ServiceNow's other solutions on the ServiceNow platform. Everything again resides on a single data model, so it's really a lookup, or access has to be provided in order for that connectivity to happen. So we've actually got customers who have implemented this use case where Avenir, based on the contract risk, based on obligations discovered, those are then shared back with VRM to provide a holistic picture of the risk. And any new risk that VRM also detects, that needs to be surfaced back, for example, to contract managers, to make sure that those risks are now being incorporated, or the mitigation for those risks is being incorporated in the contract. So that connectivity, we've also seen our customers implementing.
That's all the questions we had. Thank you so much, Sunil.
Thank you, Shiny.
With that, we can call it a wrap. Thank you all for being a wonderful, engaged audience. We would love to hear from you and get deeper into the world of possibilities with generative AI. Thank you once again, and I wish you the best in your contract management journey.